The maternal mortality rate in Pakistan is 276 per 100,000 live births, which means 276 women will die prior to delivering a baby, during labor, or in the 6 weeks after they give birth. There are a number of reasons that this figure is so high. It is because of a lack of access to resources, it's because there aren't enough healthcare providers to go around, it's because women are not able to make their own reproductive choices, it's because women get married too early and their bodies cannot deal with labor. My interest in reproductive health and rights goes back to 2008 when I graduated from undergrad and I started working at this organization called Aahung that works on sexual and reproductive health in Pakistan. I had a lot of field experience and it was really rich, but at the same time it was self-limiting and I felt like I really needed to learn more. I decided to pursue a master's in public health and I applied for the Fulbright scholarship, which is how I ended up at the public health school at Columbia University. While I was pursuing my degree, I started working with the International Rescue Committee in New York. I was working on a project that looked at healthcare providers from 4 refugee camps in developing countries, and there was a recurring issue of an extreme shortage of skilled healthcare providers where they're most needed. There was a nagging thought I had that if I had a clinical skill, if there was something I could do with my hands, maybe there would be a way I could directly contribute to this issue. When I returned to Pakistan, I wanted to explore the idea of midwifery a little further, and I know that the Cowasjee School of Midwifery at the Lady Dufferin Hospital was a really good school, but the idea that I wanted to be a midwife was not taken seriously at all. Our work as midwives is often misunderstood, and when you try to translate the word midwife into Urdu, the only available word is dai, which is synonymous with unskilled birth attendant. The role of a skilled midwife is to provide antenatal care, conduct deliveries, provide postnatal and newborn care and childcare up to 5 years of age. My experience as a midwife in the labor room has been mixed. There are highs and there are lows. You celebrate with women who have a healthy baby, but then you also mourn with women who have experienced loss. Assalamu alaikum Amna, kaisi hai? Your baby theek hai? Another really big part of the midwife's responsibilities is to provide compassionate care to women during this difficult stage in their lives. Other than the physiological challenges that pregnant women face, there are also a lot of emotional challenges that they face. Sometimes a mother's need is simply for someone to hold her hand during labor, and that's where a midwife comes in. A midwifery degree actually gives me the micro-level context that I need to go with my macro-level degree to be a better public health practitioner. As a trainee midwife, there were a lot of things that were really new and surprising to me. I never knew what the urgency of people's healthcare needs are and how you have to always be ready to respond to those needs. For example, if a baby comes out and needs neonatal resuscitation, you have only 1 minute in which you can save that baby's life. Another thing that was really surprising, which I felt that I was maybe not ready for, was that a lot of people come to the Lady Dufferin Hospital for specialized maternity care, and despite the fact that the services here are highly subsidized, a lot of them still are unable to afford very basic and urgent things such as blood and lab tests and money for incubator fees for newborns. And one morning we had a baby who was really sick, so I drew his blood and I called his family to take the blood for a test. So the grandmother came and she said, I can't afford this test right now, it costs 1,500, but this is all I have. And she emptied her pockets and all she had at that moment was 5 rupees, so she gave the blood back to us. It was instances like these that led me to start the Mama Baby Fund, which is a rapid response fund that caters to the needs of mothers and newborns. There are a range of things that we fund, which includes blood tests, life-saving injections for newborns, insulin for diabetic women, and baby clothes. In its first 10 months, the Mama Baby Fund has been able to help more than 150 families at the Lady Dufferin Hospital alone. My name is Neha Mankani and my mission is to provide women with quality maternal and neonatal health care.